ChatGPT, a generative artificial intelligence AI chatbot, has recently been hailed as a promising tool to improve healthcare quality. One study compared output from the AI chatbot for medical questions with answers from physicians. Other studies have evaluated the AI chatbot's responses to sample clinical vignettes, a foundational aspect of high-quality healthcare. Making a correct and timely diagnosis remains a challenge in modern medicine. Despite decades of technological advances, therefore, any emerging technology with potential to reduce diagnosis errors warrants serious examinations. Recent literature provides some suggestions as to what role AI and the AI chatbot may have in assisting with diagnosis. However, clinical diagnosis is both an art and a science, and is more challenging for AI to optimize than visual diagnostic interpretation, such as radiographic and pathological diagnosis. Here we provide a realistic overview of generative AI's role in clinical diagnosis to clarify high-strength challenges and future opportunities. Diagnostic dilemmas are common in clinical medicines. Arriving at a final diagnosis is a process that evolves over time and can include periods of uncertainty. One potential use of AI is to identify rare diagnoses or unusual presentations in particularly complex cases. Historically, clinicians relied on their memory to recall rare conditions or unusual clinical presentations. If a patient had a certain constellation of signs, symptoms, and laboratory and radiographic findings. In modern times, clinicians often use internet search engines, online resources, or differential diagnosis generators to assist with unexplained clinical presentations. Pending evaluations of effectiveness, the AI chatbot could become an additional tool to help with the diagnostic dilemmas. Conversely, AI applications must also address common diagnoses. Because most harm from diagnostic errors involves common medical conditions, effective use of AI chatbots could ensure clinicians have considered all common conditions that might explain a patient presentation. For example, dyspnea on exertion, anemia, and hyponatremia are classical general medicine problems, but clinicians often rely on their memory when performing their diagnostic evaluation, a valuable approach. Additionally, laboratory or radiographic findings might not be interpreted correctly by clinicians. The AI platforms can be consulted potentially in real time to ensure that obvious diagnostic possibilities have not been overlooked. Ideally, the platform would be embedded into the electronic health record to make this consultation highly efficient. AI also has the advantage of being able to scan a patient's medical record faster than a personal scan. Clinicians often spend long periods trying to decipher a patient's story and longitudinal journey by clicking through sources of notes, laboratory trends, or radiology and pathology reports. In additional diagnostic data with associated visualization platforms, AI could display this data in a more intuitive way and potentially assist with nuanced interpretation of such cumulative historical data. Despite their potential benefits, AI fundamental limitations and challenges require care consideration as AI is further integrated into medical care. Of paramount significance is that the accuracy of data about the clinical case entered into the chatbot will determine the differential diagnosis output. However, research has demonstrated that many diagnostic errors are related to core clinical skills, including history, taking medical examination, and other data gathering activities. Information gathered from these actions serves as the basis of what an AI chatbot would use to assist with diagnosis, and this information might be incomplete or incorrect. Additional patient histories are by nature subjective. A patient who describes their pain as stabbing or as 10 out of 10 on a fan scale might give subtle cues that provide important context but which only a person can detect. Subjective and varying reports from patients are more difficult for AI to consistently use is in an algorithmic way. Many features also describes a myriad of symptoms. Sorting through the relative importance of each of these is often best done by a skillful clinician who can relate to the patient emotionally, understand subtle nuances, observe minor clues, and deduce the most salient features of what the patient is describing. Some patients might also be more reticent due to Some patients might also be more reticent to describe certain symptoms or other medical history. It often requires a compassionate clinician to make an interpersonal human bond with the patient. To elicit a complete history, AI, at least in its current form, is likely unable to do this, and many scientific advances would be required for it to gain this ability in the future. The accuracy of physical examination finding can also force limits to AI's effectiveness. A chatbot might arrive at a more accurate diagnosis if it knows the patient's jugular venous pressure is evaluated on their suprapubic tenderness. However, this assumes that the clinician has accurately assessed the patient's jugular venous pressure or has correctly detected suprapubic tenderness. This fundamental aspect of patient assessment, the accuracy of the practitioner's clinical examination, will remain paramount even with AIs in increasing role in supporting clinical diagnosis. Another significant challenge in advancing AI diagnosis is judging the accuracy of the diagnosis itself. Many medical diagnoses do not have final confirmatory test. For example, common diagnoses such as cellulitis, pneumonia, and decompensated heart failure rely on clinicians agreeing on a final diagnosis, which does not occur in all clinical cases. AI is likely most helpful in diagnosing conditions like that are objectively or numerically true, such as diagnosis of acute kidney injury when a patient's creatinine level has risen from 1 milligram per deciliter to 3.5 milligram per deciliter 2 or 3 days. However, determining whether a patient truly had pneumonia is less straightforward. The general constellation of findings for this diagnosis includes systemic symptoms such as fever, cough with sputum production, and neutrophilic leukocytosis. However, the presence or absence of any one of these findings does not definitively confirm or refute the diagnosis. Assessing the accuracy of AI's ability to diagnose differs from examining its ability to beat a person at chess or solving mathematical problems. In these classical examples of AI success, everyone agrees on the accuracy of the final product. Conversely, the final diagnostic answer might remain uncertain in many instances, even if the patient improves. Clinical diagnosis often involves gathering and interpreting imprecise and non-numerical diagnostic data and includes the possibility that no objective pathognomonic test exists for the diagnosis in question. Thus, judging AI accuracy in clinical diagnosis is particularly challenging outside of well-structured case vignettes. Finally, consider a hypothetical scenario in which a chatbot has finally achieved the ability to diagnose better than people. Even if this were achieved at the present time, AI cannot replicate in-person human-to-human empathy. A recent study suggested that AI chatbots were more empathetic than physicians, but an important caveat was this study considered only routine interactions. Most patients want their treating clinician to be accurate in the diagnosis but also empathetic during verbal and in-person communication. This core aspect of the patient-clinician interaction at its most fundamental and human level is expected even in modern times, and it is unlikely AI will replace in-person human connection soon. In some, support from AI when integrated effectively into clinician workflow can potentially improve quality of care, including diagnosis. However, in its current form, the advancement of AI do not effectively account for certain real-world aspects of making a clinical diagnosis. These factors include fundamental clinical skills required for clinical diagnosis, such as history taking and physical examination, accuracy of EHR data, uncertainty in accuracy of a final diagnosis, and in-person empathy and communication. These considerations must be addressed as AI is used to improve diagnosis in the 21st century.